And what prompted me is that in 2014, I lost my grandmother at Mulago Hospital just because she didn't have enough blood. And I was like, why shouldn't I donate blood to save more people out there in the world? That there are more people who are dying like my grandmother, and they just need a unit of my blood for them to be alive. I gave 500 meals. They gave me a card that shows that I've donated blood. I even got a pen that I've kept up to today. I usually show it to people that I have saved lives of people out there. My first experience, I've gone through it. I'm also guided on what I should eat in order to donate more blood. I get my blood group results. On top of that, my age status results. On top of that, I've lived a healthy life for the last 3 months because I know what to do.
The students over there in institutions, they should continue donating. If you donate once, twice, thrice, continue, because blood is a drug, because we know it can save life.
I've been transfused many times because of sickle cell patients. Our disability is with the blood. My hemoglobin levels would go down very easily and at a very fast rate. So when the body does not have hemoglobin, it is actually not working in the sense of working. The heart cannot pump any blood, so you will actually lose your life. So I was at the instance of losing my life before I had been transfused.
A normal person is supposed to have 5 to 6 liters of blood. Now, if someone has lost maybe blood in a road traffic accident, then we have to replace it with blood, which has 2 components: the cells, the red cells, and then the fluid part of it, which is called plasma.
This is one of the units, sickle cell clinic, where blood transfusion takes place. We have about 1,700 patients in this clinic. Once the hemoglobin level is 5 and below, the doctor recommends a transfusion. For children who have stroke, as long as their HB is less than 10, they are at risk of getting another stroke. So wherever we run the CBC, the HB is below 10, even if it's 9, they will need a transfusion. When the child is having a chest crisis, when he's breathing badly, even if the HB is high, the doctor usually recommends a transfusion. If we are to really meet the demand fully, we need around a minimum of 5 units of each group. However, most of the times this is not met. We find a very big challenge. Most of the times the children are anemic, but there's no blood. And so in such cases where we've not been able to provide the blood, we refer these patients to acute care unit for admission and waits for the blood from there. Day 1, day 2, there's no blood. The child's HB is 2, the child dies. We've seen them passing on.
I continue to encourage anyone else in the world who is eligible to donate blood that you should. Anytime that you can and you're eligible, you should, because you never know who you're helping. You have very many patients. Aside sickle cell patients, there are very many other accident patients, other patients who have aplastic anemia, cancer patients who need that blood. So wherever you are, you never know whose life you're saving.
Why don't we put a bleeding site within Mulago that is working every day? The caretakers are like, where can we go and donate? You start explaining issues of Nakasero, you see Nakasero, it's another bureaucracy to reach there. But if it was like, where can we go and donate, and you're like, just look down there and donate, it would be easy. Even we get some other clients, they're like, do they donate blood within here? That no, you have to go to Nakasero or any camping you find somewhere. They're like, oh, I wish there was one here. So if they can put a camp for blood donation within Mulago that is there on a daily basis, that would be good enough. And if we can afford a blood bank within Mulago, that would be the best.
Young people, like in schools, they are more, they have better source of supply of blood than adults. So we usually go to institutions to get donations, and when we bring that blood for testing, you find like 90% is good, and when you go to communities, you find almost 60% is bad.
Who am I that my blood flows into the vein of someone in order for that person to have life? With your blood, you're going to save more mothers that give birth to the nation out there. With your blood, you're going to save the accident victims that are out there. Given the fact that one day there is that person who will need blood. Accidents are real. Mothers who give birth every day are real. Keep yourself free from drugs. Keep yourself free from smoking. Live a healthy life. You can go after every 3 months and donate blood. It starts with me and you, what I know. Keep yourselves healthy. Eat healthy meals. Keep yourself free from drugs. And endeavor to donate after every 3 months. If you have 50 kilograms, if you're 17 and above, and if you live a healthy life, then there is nothing that is going to hinder you to donate blood.